Across the nation, areas as diverse as Boston, Massachusetts, King County, Washington, and Cincinnati, Ohio have formed collaborations where leaders from different sectors work together to improve their communities. What makes these initiatives unique is their commitment to shared measurement systems, strategic alignment, open communication, and an independent organization which supports their efforts. In 2006, Pinellas County undertook a similar effort when it envisioned a better health and human service system for its community. This led to the creation of the Health and Human Services Coordinating Council for Pinellas, known as the HHSCC. The HHSCC works with funders and providers from across the community to develop improved systems of care through aligning resources and providing evidence-based services. Comprised of three major components, a policy board, an administrative forum, and 5 leadership networks, its structure is designed to engage a broad array of stakeholders to achieve collective impact. The policy board consists of county commissioners, juvenile welfare board members, and the county sheriff. It provides guidance for the work of the HHSCC and connects the HHSCC to the major governing bodies of the county. The administrative forum brings together leaders from the county's major funders of health and human services to share knowledge and to develop consensus around a common agenda for Pinellas County. They have created technologies to support data-driven decision-making, such as a community investment profile and a community indicator system. These systems tie our investments to desired results. This framework and level of coordination supports powerful collaborative efforts throughout the 5 leadership networks. The leadership networks, made up of community stakeholders working together around a particular focus area, are an important component of the HHSCC. 2 of the networks, the Low-Income Housing Leadership Network and the Homeless Leadership Network, focus on ensuring that every person in Pinellas County has stable and affordable housing. The leadership networks, however, employ different methods to achieve this desired community result. The Low-Income Housing Leadership Network works with community leaders to expand housing opportunities for households whose income is below 80% of the area median income. The Homeless Leadership Network, meanwhile, coordinates homeless services and works to end homelessness in Pinellas County. Illustrating these complementary methods, the Low-Income Housing Leadership Network created a public-private partnership between family shelters and private landlords to move families with children out of homeless shelters and into vacant apartments throughout Pinellas County. Conversely, the Homeless Leadership Network joined with cities and the judicial system to develop Pinellas Safe Harbor, a shelter operated by the Pinellas County Sheriff's Office to provide homeless men and women with a safe environment while they work to get back on their feet. Each leadership network also undertook policy initiatives. The Low-Income Housing Leadership Network met with state legislators to talk about the importance of the State Housing Trust Fund to our local economy. The Homeless Leadership Network and the Pinellas County Coalition for the Homeless, on the other hand, merged into a single entity known as the Homeless Leadership Board. This board is designed to be a better vehicle for planning, managing, and funding homeless services in Pinellas County. The third leadership network is focused on health and behavioral health care. Its mission is to promote health and to provide access to health care for vulnerable populations. One example of its work is the Diabetic Equity Project, where a broad coalition of providers works with the St. Petersburg Free Clinic, Diabetic Charitable Services, and the Pinellas County Health Department to serve uninsured diabetics in the St. Petersburg area. These agencies have combined resources to assure that clients receive primary and specialized care services, as well as case management, medication, and supplies to help them manage their disease. The fourth leadership network, concentrated on disaster recovery, works with Pinellas County Emergency Management following a major disaster to support human service organizations throughout the county. A long-term recovery organization has been created to benefit citizens who have unmet needs in the wake of a disaster. The Disaster Recovery Leadership Network also works with county and regional disaster experts to develop the human services component of the Post-Disaster Redevelopment Plan for Pinellas County. This plan guides local government decision-making during a difficult disaster recovery period and provides a course of action to make our community more resilient in the future. Even more exciting collaborations are on the horizon. In 2012, the HHSCC will launch its fifth leadership network, a cradle-to-career education initiative called the Learn and Succeed Network. This network will bring together partners from across the education and workforce spectrum, from the earliest stages of child development through to the workforce of the new millennium. Community leaders, education professionals, and business partners will be engaged in improving the educational and career outcomes of Pinellas County residents, beginning at the first network gathering on February 8th. Like other places in the nation, Pinellas County is realizing the benefits of working collaboratively, sharing data, and creating a common agenda. The Health and Human Services Coordinating Council for Pinellas County is committed to supporting the work of our partners as they strive to create a healthy, vibrant community.